This is Uncensored Conservatism, episode 152, Project 2025. What exactly is in this controversial thing? We're working on chapter 14, part 2. So, we're continuing to look at health and human services, and let's turn to Medicare and Medicaid, two programs that touch more American lives to a greater degree than any other federal program. First, Medicare beneficiaries should have greater control over their health care. The patient is in the best position to make decisions about themselves. Likewise, they benefit from more choice among doctors, hospitals, and insurance plans. Regulatory burdens on doctors should be eliminated. They shouldn't make medical decisions based on a reimbursement schedule. As far as the price for services, patients, doctors, and taxpayers are best served by transparency in those prices. The government uses a non-market-based system for determining reimbursements. This leads to overspending on low-quality outcomes. Reimbursement should be based on value and outcome. Waste, fraud, and abuse can be detected through an increased use of artificial intelligence instead of pencil pushers in Washington, D.C. Regulations that stress inpatient-only solutions should be relaxed to allow more ambulatory centers to cover more procedures, which then tend to be cheaper. Because Medicare pays for inpatient hospital procedures that have the same outcomes elsewhere, there should be cost neutrality for a procedure no matter where it is performed. Plus, often doctors have to compete with big hospitals when they could perform some procedures on an outpatient basis, cheaper, and with the same outcomes. And of course, practitioners should be allowed to participate in the Medicare program or any program, despite their views on abortion or gender-affirming care. The government cannot compel them to accept what their conscience rejects. Obamacare disallows Medicare payments to physician and specialty hospitals. This should be rescinded. The big hospital systems don't want that competition, and they received a Medicare monopoly thanks to Obamacare. There should be greater competition between Medicare Advantage and private insurance plans. In fact, more seniors are opting for it rather than traditional Medicare. Why? Because it provides the consumer with a greater choice of insurers and at a reasonable cost. Medicare Advantage has been registering high marks for customer satisfaction and high-quality medical care. Project 2025 suggests making Medicare Advantage the default plan for all eligible Americans. Beneficiaries can be given a greater say over how their Medicare dollars are spent through basing payments on the health status of the patient rather than where they happen to live. Right now, the fee-for-service system is bureaucrat-driven. A value-based system would empower the patient, and they would drive down costs. And of course, price regulations should be codified. Drug subsidies under Medicare are directed at hospitals when they should be directed at the beneficiary. The Biden administration negotiated with Big Pharma about the cost of diabetes drugs. Well, that's all great, but it's also a price control scheme. Of course, it doesn't address any of the new drugs that come on the market for diabetes or any class of drugs in other areas. There should be negotiation for price ranges, not price controls. Next up, Medicaid, which has become a huge, cumbersome, complicated, and costly burden on every state. The increased Medicaid expenditures are solely attributable to this, Obamacare, which mandates eligibility for anyone at the 138% of the federal poverty level. And because of this, COVID, and the so-called health emergency, states were prohibited from reviewing eligibility rules. Of course, states administer Medicaid, and they should be at the forefront of any reforms. Severino suggests block grants with no strings attached or aggregate or per capita caps. We should be moving people off Medicaid, not onto it. The current funding schemes encourage expansion. If states decrease waste, fraud, and abuse on a demonstrable basis, there should be a financial incentive for doing so. Of course, it all starts with eligibility requirements. Medicaid is intended for the truly needy. Medicaid recipients should be able to make their health care decisions and take some responsibility towards paying more for it. Medicaid serves a broad range of recipients, but there is a one size fits all mindset. The benefit must match the actual need, and there should be work requirements to help achieve these goals. Project 2025 suggests the personal option where a Medicaid beneficiary uses those allocated dollars to help purchase a private health insurance plan. There's also the possibility of flexible accounts that reward healthy lifestyles like weight loss and smoking cessation. Middle and upper income Medicaid recipients should not be eligible for the benefits. It wasn't intended for them. It's for the needy. Direct primary care is probably one of the best methods of lowering healthcare costs overall. This is where doctors contract with patients on a subscription basis, regardless of how or where care is given. This method delivers high quality medical care at a sustainable cost while strengthening the doctor-patient relationship. But guess who's getting in the way? These guys. The federal government with onerous regulations and misclassifications. Medical billing is a major issue as many people are surprised to see their care bills. The dispute resolution process is convoluted, but there is a solution. The No Surprises Act, which scraps the dispute resolution method and replaces it with a truth in advertising approach, so that the healthcare consumers know costs up front, not at the end. There should be pricing options. If you're a healthy 30-year-old, you should not be paying the same or near premium as some fat slob who smokes and eats potato chips for dinner. Healthy lifestyle choices should be rewarded to reduce premiums. One of the worst things ever is this, Obamacare. Because of it, healthcare insurance is actually now more expensive and there's less competition among insurance. Hospital price transparency should be enhanced, and quality of outcomes should likewise be posted. As COVID proved, we should expand the scope of clinical laboratories with greater regulatory flexibility. Now, the Hyde Amendment has long been used to prohibit the use of HHS funds for elective abortion. However, this guy lifted some restrictions, allowing women to obtain an abortion by traveling out of state to get them. The Justice Department determined, erroneously I might add, that the Hyde Amendment applied only to the abortion itself, not the travel associated to get an abortion. This is a perversion of the Hyde Amendment. In 2021 to 2022, Planned Parenthood performed 383,000 abortions. They also reported $2.1 billion in assets and $133 million in excess revenue in that same period. In that period, they received $633 million in government funding and another $579 million in private donations. Meanwhile, Planned Parenthood has suffered fraud and abuse allegations and profited off the sale of aborted fetal parts. Just end all funding for Planned Parenthood and redirect those funds to health centers that provide real health care to women, because abortion is not health care. Further, Health and Human Services can issue guidance that they will not oppose state-level efforts to prohibit Medicaid payments to Planned Parenthood. There's a Supreme Court case this year over such an effort in South Carolina. The Weldon Amendment provides that no funding can go to a state that discriminates against pro-life entities or insurers. In blatant violation, 15 states mandate abortion coverage in healthcare insurance plans, and Health and Human Services continues to fully fund those states. If any state does this, they should lose those grants and up to 10% of Medicaid funds, according to Project 2025. California has announced they will discriminate against any pharmacy that refuses to sell abortion drugs, even outside California. They are currently cutting contracts with such pharmacies. Obamacare notes that elective abortion coverage should be separate from all other healthcare insurance, which was promptly ignored by this guy. Trump then tried to rescind the Obamacare provision, tried to enforce it, but it was rescinded by this guy. These clowns can't even enforce their own damn signature achievement. EMTALA needs to be enforced. Listen, Amber Thurman. She did not die because of Georgia's abortion law. She died because the supposedly 99% safe drug failed to work as planned. EMTALA mandates that pregnant women, whether they drove to North Carolina to get an abortion or are suffering a miscarriage or whatever other medical emergency, that they be stabilized by a hospital. It likewise mandates protection of the unborn child, if possible. So that a hospital in Georgia with Amber Thurman and that woman in Texas with a miscarriage, they were victims of non-enforcement of EMTALA. And by the same token, allowing a live birth to die on a table without any intervention in states run by this weirdo likewise violates EMTALA. Gender reassignment surgery should not be paid for by Medicaid. I'm sorry, this is just uncivilized to castrate males and perform an unnecessary hysterectomy or mastectomies on girls because of a mental problem. I mean, do we tell the schizophrenic that it really is Jesus or the devil is talking to you? I mean, come on. In 2022, Health and Human Services issued a policy redefining sex and discrimination in healthcare. Sexual orientation, gays, and gender identity, transgenders, are now defined as sex under Obamacare. Finally, the vaccine mandate on personnel in hospitals that receive Medicare or Medicaid funding should be rescinded and refrain from doing so in the future. And I'll pick up on some more of this in part 3. Until then, have a great day and a more pleasant tomorrow.